Welcome to the Minority Health Disparities Initiative Health Equity Speaker Series. As the name implies, this is put on by the Minority Health Disparities Initiative. We are an interdisciplinary collaborative unit at the University of Nebraska-Lincoln. We have affiliates, including our speaker today, Dr. Sharon Obasi, who is our liaison at the University of Nebraska-Kearney. Dr. Obasi is an associate professor of family science and director of research integrity. And she'll be giving the talk, as you can see, Embodying Identity, Names, Gender, and Equity. As a bit of brief background, Dr. Obasi is an interdisciplinary teacher, scholar with a background in behavioral neuroscience, currently conducting research on the impact of family on self-identity and social identity, and the articulation of policy and programs to help marginalized communities. So with all of that, and without any further ado, I will turn it over to Dr. Obasi. Thank you for coming today and being with us.
Thank you so much for the invitation and for the introduction. It's truly an honor to be here. Thank you to all of the attendees for taking time out of your day to spend some time having a conversation about identity, embodying identity with respect to names, gender, and equity. So here's my plan of action for today, just to keep myself honest. I'm going to start off with some basic definitions, make sure we're speaking the same language, as it were. I'll talk about some of my work with respect to social and self-identity, specifically naming and renaming. I'll then focus on some work I've done collaboratively looking at equity and identity in healthcare spaces. Then I'm going to end with some tools and resources you may use when you're teaching or perhaps engaging in research in this broad area. So as was mentioned, who am I, why am I here? I'm Sharon Obasi. And my interest in identity really started with my return to academia. So I started off in behavioral neuroscience. I spent a number of years working on models focused on health-related changes in eating, especially under eating or hypophagia. So I spent time looking at if you manipulate estrogen, progesterone, cholecystokinin, what happens to taste, palatability, and so on. And then life intervened and I left academia. And when I returned to family science, which happens to be a discipline where we focus on educating and advocating for and empowering individuals, families, and communities. And as you can appreciate, when I first joined the discipline, had some thoughts around my fit with the discipline, my identity with the discipline. And that really was the genesis, the impetus behind my initial work in this field. As you can appreciate, my research participants resembled entities on the left of your screen initially, and now I work with research participants who resemble individuals on the right of your screen. So that was the basis for my interest in identity. And I really started thinking about what is identity? How do we cultivate it? How do we develop it? How do we manipulate it? How do we modify it, and so on? So I will spend some time focusing on that particular sort of work today. Now, in identity, we think of that as a sense of self. And you can think of the fact that there are a constellation of factors that influence how you may identify as you move through the world. So your place of birth, your place of residence, your culture, your subculture, your subculture. It could be your age, your work relation, the media, a whole host of things go into how we may identify. Now, what's fascinating is if you happen to strip identity down to its core components, the argument has been that identity is simply a matter of physical body, however it is expressed in the world, and name. And this happened to be the theory proposed by British sociologist Jane Pilcher. So she argues that identity is basically this name-body nexus. And if we were to compartmentalize it, we can strip it down to just the body, however it's expressed, and the name associated with that body. So for example, my name, Sharon Obasi, is not necessarily unique to me. If I happen to estimate in the US population, I happen to have, according to howmanyofme.com, I happen to have the 55th most common name for girls, for females in the US, Sharon. 877,000 other people in this country share my name. My last name, Obasi, less common in this country, but certainly not unique to me. You combine them, still not unique historically, and currently there are several people who walk around with this name. What makes me, at its very core, is that name associated with its physical representation you're seeing before you. Now, I found this fascinating because if you think about names, first, they carry a wealth of information. Cross-culturally, social-culturally, lots of information imbued within names. The other part of this is, if name is core to my identity, names are rarely ever self-selected. So my first interest, my first approach was, let me examine what it means with the context of naming, what it means in the context of families, and so on, as we discuss building identity. As you can appreciate, the minute that there is a notice, an announcement of an impending arrival of a newborn, one of the first questions ever asked is going to be usually about the naming of that particular child. And of course, there are a whole host of factors that go into naming. So my first project I want to talk about today happens to focus on naming strategies and renaming strategies. So in terms of what is on the screen right now, the comic strip illustration, we all have a naming story. We may not always know it, we may not always have a fully realized, understood, a fully realized understanding of it. We all have a naming story. So and because I love collaboration, I'm going to ask you to think about your own naming story. What is your name? Who named you? Why were you given that name? As we proceed through the course. And if you're comfortable doing so, please feel free to drop the responses of your naming story into the chat. We can always talk about them a little bit later at the end of the talk. So when it comes to naming strategies, cross-culturally, there are a whole host of really interesting ways that different communities approach naming of children. And there are several examples I can talk about, but three that really stand out in this country and across the globe are as follows. We've seen instances historically and sometimes in other cultures still currently of necronymic naming, the idea that you will name a child after a deceased sibling. Social historian Daniel Scott Smith, in working, looking at naming practices in colonial USA, noted that was quite a common practice. As you can appreciate, life expectancy was perhaps different than it is today. And so sometimes you had instances of individuals who you would have family lines where you saw, for example, a William, then a second William, and unfortunately, it may mean the first William passed away. We've now named our child the same name and so on. We've also historically seen naming strategies that are mononymic naming strategies, so single names only. A clear example of this is the naming of enslaved individuals in this region. As you can appreciate, slaves were not allowed to have names. To have a name would be to humanize, and they were not considered human beings. But sometimes they were given names, and usually just a single name. And if you look at the historical records of runaway slaves and so on, you would see, much like Pilcher argues, they're identified based on a single name and a physical description of the body. What we also see across the globe is a huge familial impact, a huge familial input into naming. I had the honor of working in Kazembe, Zambia, which happens to be a very small rural community about 2 or 3 hours east of Lusaka. And in that community, I was doing some work looking at family dynamics and so on. And I was asking the ladies about the naming practices of, in the community. And they shared with me, in that particular community, naming is done by the males only. So the fathers, the grandfathers, the great-grandfathers get to decide what a child is going to be named. And only on rare occasions, you may have a female who may be involved in that particular process. So I found that really fascinating. What we've seen cross-culturally as well, historically and also in contemporary times, is this practice of namesaking, i.e. naming a child after a specific family member, deceased or alive. Now, this is intriguing because there's several reasons that we've identified or have been proposed historically and currently as well to explain this practice of namesaking. One particular theory is Vicari's mortality salience theory that argues that perhaps we engage with this practice because we are aware of our impending demise, and it's a way to, ensure that we live on in some way through our children, our grandchildren, and so on. The other approach, or the other theory to explain this practice, is work done by Brown and colleagues in what they call the honor states. Honor states, according to their research, are the states in the US, the southern states, that tend to have very strong traditions, a very strong military affiliation, a very strong patriotic belief systems, and so on. And they also seem to engage in namesaking, making sure that the names continue in the family line. There has also been the observation, or the hypothesis, that perhaps we engage in namesaking because it is a practical way of demonstrating kinship. It's a way of ensuring parental investment. The classic work in this area is by Furstenberg and Talviti, who found in their particular study that when they looked at the children born to single mothers, if those kids were named after their dads, those kids over time tended to have more social contact with their fathers, closer bonds with their fathers, and more financial support from their fathers. So I found this idea, again, starting out in family science and identity and naming, I found these ideas really, really compelling. So I wanted to look at namesaking, naming patterns, and namesaking in particular in my particular new part of the world, which happens to be Buffalo County, Nebraska. So that's where I started. It was a very user-friendly, economically simple, user-friendly, economically easy study to do. I simply looked at birth announcements in the local newspaper, the Kearney Hub, over a series of decades to see if we did see namesaking in this region, which would make it more akin with what we were seeing in some of the southern states. Also wanted to see what it looked like in this particular area. The Kearney Hub catchment area happens to include Buffalo County primarily. We also saw announcements coming from Phelps, from Kearney, from Hall County, and from Adams County as well. So we looked at over 800 birth announcements in this way. Now, in this particular study, namesaking happened to be any evidence of a child being named after someone mentioned in the birth announcement, irrespective of the placement of that name in the sequence of names. So to illustrate, if we look at baby Brett here, his name happens to be Brett Robert. So this particular announcement would have been coded as baby boy. It would be coded as first child because there's no reference to a sibling. Would have been coded as namesake because he's sharing a name with his paternal grandfather. In comparison, we looked at this announcement. We have Cassandra Alice, would have been coded as firstborn girl, but second child. And she's also sharing a name, also namesake, also sharing a name with an ancestor. In this context, we could not determine whether it's matrilineal or patrilineal based on the names. So, but that was basically how this first study was done. In terms of observations, there were a couple of things that really jumped out at us in terms of our work. So number one was the observation that there was a birth order effect when it came to naming. The fact that if you are a firstborn child, irrespective of being a boy or being a girl, you're more likely to be namesake, i.e. named after someone referenced in the birth announcement. The other observation was patrilineal bias in naming. So again, if you're being named after a relative, you're more likely to be named after the paternal side of your family. So to look at the image on the screen, so the girl to the far right, firstborn child, probably named after a family member. second child, firstborn boy, definitely more likely to be named after a family member, especially on the paternal side. The argument there being that, as you may appreciate, inheritance laws in the US tend to be derived from the paternal side. And so that may explain why there is this bias in paternal naming, but that yet remains to be fully explored and fully articulated. Now, clearly in this study, I'm making inferences from birth announcements. So I wanted to, in another user-friendly, economic way of doing research, I wanted to just have a simple study looking at having individuals tell me their naming stories and tell me how they got their names, how their names were derived, and so on. This project is ongoing, but so far we have 107 participants, 107 different naming stories, 35 who are namesake, i.e. named after specific family members. And when they tell me their stories, there are again three broad themes that kind of jump out at me. Number one is that there's this reference to the sense of family tradition, the sense of carrying on the familial heritage and so on. There's also a reference to this idea of honor. So the name was given to honor someone. What I find really fascinating, however, are the individuals who share with me they're not quite sure how they got their names, including one young man who quite expansively wrote that he's named after his mother's brother. He's not quite sure why, because in his words, they do not get along. So I found that really fascinating into, well, what's going on there in terms of family input and naming strategies and so on. So having done this work, my next interest sort of went to the idea of, in this context, we're talking about names ostensibly given by family members and so on. What about the possibility of self-naming, selecting your own name and also renaming of self? So in thinking about that, here's a second collaborative exercise for us to do. I like to think about this. If you could change your name without penalty, without prejudice, without any issues, would you change your name? If yes, what would you change it to and why? And if no, why would you not choose to change your name? Again, if you're comfortable doing so, feel free to drop your responses into the chat and we'll take a look at them at the end of the talk. So when it comes to renaming and self-selection of names, I've taken two approaches to examining this particular topic. The first approach was with a collaborative project done with a colleague of mine, Professor Youngmi Kim at Kangwon University in Korea. And Youngmi happens to be a linguist, so she's really interested in the phonetics of the name, the use of vowels and consonants and the syllables and so on. And I was more interested in just the social cultural aspect of it, and perhaps familial input into naming and so on. But in South Korea, there is policy on the books. There are laws that allow adults to change their names. And sometimes they change their names because the name is thought to, a new name may invite prosperity, it may invite success, it may invite the right partner for the individual and so on. So it's not uncommon to have individuals who go into adulthood with one name, the name given to them by their family, by their parents, ostensibly their birth names, and then they will change their names. So the interest was to look to see if we're seeing a difference in terms of how men and women, boys and girls, how they're selecting their names as they go into adulthood. This is just one graph from a full data set that we have, and we continue to collect data. But what the observation that's being made is traditionally in Korea, you had a marked gendering of names. So there's specific male names, boy names, and there's specific female name, girl names. What is interesting is, and we have a data set that begins in 1940 and goes up to current day. So 1940 up until about 1980, we had this clear separation of names. The boys had boys' names, and then they chose boys' names in adulthood. Girls had girls' names, and they chose girl names when they changed their names. By about 1980, we started seeing this decrease in this gendering. So girls were now choosing names that were less traditionally considered to be girl names, and so on. And we just applied for a grant to basically further explore this observation. Young me, Professor Kim's, her hypothesis happens to be that she says around this time you saw a change in terms of women being a bit more independent, perhaps choosing to delay marriage, choosing to delay having children, being more responsible for their parents as opposed to relying on spouses to do that. And perhaps in the workforce, it was in their best interest to have a name that was less traditionally feminine rather than and so on. So like I said before, we just applied for a grant to expand the study, but it's an intriguing observation. I was also able to study renaming and self-selection of naming in reference to identity by collaborating with Trans Collaborations. Trans Collaborations happens to be a UNL-based community research partnership. They do remarkable work looking at centering the voices of transgender and gender diverse individuals in the Central Great Plains area and beyond. And I had the honor of working with them on some different projects. The first one being this renaming project. So I happened, by pure happenstance, I met a couple of colleagues from Trans Collaborations, and I asked the question, I said, do you ever look at naming and renaming and name selection and so on? And they looked at me and they said, no, we do not, but thanks, interesting question. Thanks for asking. About 6 to 8 months later, I got an email one day that said, hey, we're doing a national survey. Do you want to put some of your naming questions on our survey? And I'm like, sure, thank you so very much. And that's what I did. So the survey that they sent out was like a 200-item health assessment survey. It had questions about access to healthcare, physical healthcare, mental healthcare, insurance, and so on. And then I was able to add on about 30 questions specific to naming and renaming. And it was a nationally disseminated survey. About 200 plus participants actually took part in that survey, but 55 individuals quite graciously gave me their naming stories as part of the survey. And so I'll be focusing on that information as I proceed. So when it comes to the demographics of the participants, again, we have a sample that is primarily identifying as being white or Caucasian American. When it comes to gender identity, we have a sample that is identifying as either gender diverse or trans feminine or trans masculine. I will say this: when we first did the study, the individuals that we now call gender diverse, in that study, the term gender nonconforming was used. You will see as I proceed through the talk, some of these terms may change as we become more aware of and sensitive to the best way that individuals choose to be identified. And so keep that in mind. You may see some of these terms may change as I proceed through the talk. Anyway, so I asked them a series of questions about their naming and how they acquired their name and when they opted to start using their name and so on. Just a bit more info on demographics. This sample happened to be comparatively young, so mid-20s to mid-30s, well-educated. They had bachelor degrees, and they were religiously affiliated. So they had a sense of being involved in some religious community in some way. So my questions were like really, really simple. I just wanted them to share what they could with me quantitatively and then qualitatively with their naming stories. So basic question: tell me about your birth name. Was it considered masculine, feminine, a neutral name, and so on? And as you can appreciate, individuals who are trans masculine said their name was actually considered to be feminine, and those who are trans feminine said it was actually considered to be masculine, and so on. And so that was a great place to begin. I then asked about their current name. Did they choose to use a different name? Is it different from their birth name, and so on? And as you can see, overwhelmingly, they all said yes. I then wanted to find out when they started to use use that particular, dare I say, new name, and they renamed themselves. What was interesting to me was individuals who are transmasculine, several of them indicated that they started using their new name, their chosen name, quite early in life. I had one a person who indicated that the name was selected. They chose their name when they were 3 years old, and from that point on, that was their name, and that's what they use up until today, which is fascinating. I asked about what their current name looked like. Is the current name now considered, how does it fit with the gender identity and so on? And they responded, as you can appreciate, the transmasculine individuals indicated, well, yes, now my name fits me, now is deemed masculine and so on. And then for the trans feminine individuals, now my name fits me, it's feminine, and so on. I asked about variation of the name, which was curious because I just wondered, is it a matter of you have your birth name and you modify it to fit you and so on. For some individuals, yes. For others, that was not how it happened. They had a whole different process of doing it, which I'll explain a little bit later. What was interesting was asking about the legal changing of names, because this continues to be something to be aware of. As you can appreciate, across the US, every state has its own way of handling changes to names, especially names in conjunction with gender identity. So for example, in California, to change your name and your gender identity on your documents, your birth certificate, driver's license, and so on, comparatively straightforward. Not easy, but comparatively straightforward process. In comparison to have to make the same changes, for example, in the state of Georgia, the state of Delaware, you have to have medical affidavits in hand. You may have to do a public announcement of the name change, and so on and so forth. So it's not as simple a process as it could be. And for these individuals, some of them opted to change their name legally. Others indicated that it was not a straightforward process, and therefore they opted not to do that. One last question that I found fascinating was this idea of a renaming ceremony. I'd come across some articles that talked about the fact that sometimes with the new name, there is a renaming ceremony attached. I want to ask these individuals if they engage in that practice. Very few of them actually did, but a couple of them did talk about the fact that yes, they did. It was a special occasion. They did something to mark the occasion, as it were. What was really special about this study was I wanted to capture the stories in their own words. I wanted them to share as much as they possibly wanted to about the process of renaming self and so on. So what I'm going to share with you now are some broad themes that emerged from their naming stories with respect to selecting a new name. So three main themes basically jumped out at us. One of them happened to be the observation that there was a practical approach to renaming. So individuals shared the fact that they kept the same initials, or they kept the same syllable of names. So the sound of it was similar to their birth name and so on. So that was interesting to observe. Second theme was the variation on birth names. Some individuals did actually say that, yes, my new name is a variant of what my birth name happened to be. What was particularly fascinating from a family science perspective in particular, the observation that there was still this connection to family and the role that family played in selecting the name, and the role that family made in determining what the name ought to be, what the new name was going to be. So for some individuals, family members were heavily involved in the process of name selection. And for others, they opted to choose names that were family names that would have been used, that are used by the family. And so there was still that family and that heritage and that connection being observed and being respected in this renaming process. So my work with trans collaborations, this particular project led me, or gave me the opportunity to do some more work within the space of healthcare, health equity, and certainly within the space of the connection between identity and being able to access appropriate and equitable care, as one can appreciate when one is ill or when you need help, you're the most vulnerable. And the last place you need to be disrespected or ignored or not treated appropriately is in the healthcare system. And so with trans collaborations, we've done some work that focuses on that centers that issue. And we've also provided some strategies that may be used to help if not eliminate, at least ameliorate health equity in these spaces. So what I want to talk about really quickly happen to be two studies that I've done with trans collaborations that focuses a bit more on the health equity side of this conversation. So the first project we call in-house the Letter Project, and we have two papers that we are going to be sending out, hopefully by the end of this month, that sort of like documents this particular work. But this project comes out of the observation that access to gender affirming care, and when I say gender affirming care, I mean care that respects one's gender identity. Whatever that identity happens to be, just care that respects that identity. So we know we have research that tells us over and over again that access to gender affirming care is critical. That access to this type of care is necessary in terms of reducing reports of anxiety, depression, suicide, and so on for anyone who is seeking care. We also know that we have agencies in place that provide recommendations for how to care for individuals who need gender affirming care in whatever context they happen to be experiencing it. For example, we have WPATH, the World Professional Organization for Transgender Health, that gives recommendations regarding gender affirming care in various contexts and so on. What we also recognize, however, is even with that, there are certain barriers to getting care. And one barrier that has been identified and commented on, at least anecdotally, is this idea of getting a letter, which basically is the requirement of having psychosocial evaluation prior to receiving gender affirming care. So according to the WPATH Standards of Care, version 7, if you are seeking hormonal treatment or you're seeking chest surgery, you need to have a letter, an evaluation done by a mental health professional, at least one letter in support of that decision. If you are seeking genital surgery, you need letters from two professionals to help get access to that type of care. Now, what's interesting is the standards are in place, recommendations are in place, really to ensure that individuals are, making the best decision, as it were, and to make sure they understand what services are being requested and so on. But anecdotally, the information suggests that maybe well intentioned, the practice of getting a letter isn't as welcoming, isn't as supportive as it possibly could be. So we recognize that there are barriers in this process. We have mental health professionals who may be acting, quote unquote, as gatekeepers in this process. There's evidence or there's reference to the rather perfunctory way that assessments are done sometimes. There's the issue of stigma and the lack of agency to make healthcare decisions. And of course, the variability in the way that the standards are applied between states, within states, and so on. I should make the comment here that when it comes to elective surgery, generally speaking, it seems as if there are two groups of individuals who it is recommended that they show evaluation prior to getting surgery. One group happens to be individuals seeking gender affirming care. Other group, individuals seeking bariatric surgery, bariatric care services. But even with the requirement, it seems as if for the bariatric service patients, the interest is more in terms of, are you going to be compliant once you have the surgery? Are you going to follow your eating plan and take care of yourself and so on? For individuals seeking gender affirming care, the questions seem to be not quite as supportive, as it were, in that process. So in this study, the basic question was to document the lived experience of individuals who are seeking gender affirming care, specifically the process of getting a letter or psychosocial evaluation prior to receiving gender affirming care. In terms of our sample size, it was a nationally disseminated survey. We gathered demographic information, and we also had some clinical scales on the survey as well. For example, the patient health questionnaire. And we asked questions related to the experience of getting the letter. So again, here, tell me the story from beginning to, the process of getting this letter in order to get the treatment that you were seeking. Participants did get a gift card for taking part, and we collected these data February to May of 2020. And I encourage you, I ask you to reflect on that time frame and where we were as in the entire world at the point in time we were actually asking information about this particular process. So in terms of demographic information, again, we had a sample that was primarily identified as white or Caucasian American. And when it comes to gender identity, about a little bit more than half identified as being transgender women or feminine. We had about 40% transgender men, masculine, and then we had a small group identified as being gender diverse, and so on. So first, we wanted to find out exactly what they were seeking letters for. Like, was it just surgery? Was it a particular thing? And you can see from the graphic here, they were seeking surgery. They were seeking gender affirming care for a whole host of things, hormones and surgery, and even like hair removal and so on. And in all of those contexts, they had to have an evaluation and a letter of support, as it were, to then get the care that they were seeking. So we asked about barriers to care. Can you just tell us some of the things that you found particularly problematic, particularly difficult to navigate in this process? And here are just a list of some of the things that they identified as being barriers in the process. For example, the increased stress of having to be evaluated to get the care that you're seeking, then the financial burden of this process, which is something that we recognize and we need to perhaps attend to more, is the financial costs associated with seeking care in this country. And then they also talked about the fact that one barrier obviously is the delay of the care that they're seeking. Like, again, if you need help, you're your most vulnerable. Then to have to be asked to undergo another assessment, as it were, to justify getting the help that you're seeking, so think about that process a little bit. Individuals also shared with us the benefits of being able to access, to get the letter, to access the care that they needed. Of course, a wonderful benefit would be, feeling secure in the decision to pursue the care that they're trying to get access to. And then, of course, experiencing validation in the whole process. So while there were the barriers to the process, as it were, there were some definite benefits that individuals shared with us in the process. We asked them to give like an affective rating scale of the entire process. Was it helpful? Was it harmful? Was it stigmatizing? Was it empowering? And interestingly, for some individuals, it was incredibly empowering to the point of statistical significance. So that was interesting to see. Much like my other work, there was a chance for individuals, the respondents, to tell the story. Just tell us the story in your own words about this process. And out of that, you can do a thematic analysis. And based on their own words, their stories, about 7 broad themes emerged from their words. So the idea that, the benefits, you have access to care that you really need. You have access to affirming care. You have, what's interesting is the idea that for some individuals, the letter requirement was like a check process for them. They would say, okay, this is the decision I'm making. This is what I want to do. This is what I need for myself to be healthy. And so let's see, let's go ahead and do it. For other individuals, again, the reference, again, in their own words, in their lived experiences, the negative aspects of it, the idea that there's a sense of violation of personal autonomy, a violation of being able to make healthcare decisions, and then, of course, the idea of stigma, of this process perpetuating stigma. I will say that these recommendations are what we have right now. WPATH standards are changing. The new standards, I believe, should be out sometime this year. And there's also a movement towards a more informed consent model of approaching gender affirming care, rather than this biomedical model that I've just described. So in the informed consent model, there's a greater sense of a collaboration in the decision-making process when it comes to care, rather than this gatekeeping mechanism that seems to be in place right now. So my work with trans collaborations continues, and so like I said, they have several projects ongoing. My work right now focuses on two particular areas. One of them being the idea of, we talk about health inequity. One has to think about how we are training providers to provide care. So the next project I want to talk about really, really briefly, we just published this work about maybe a month ago by now. I want to acknowledge my co-author, my co-first author, Robin King. Robin did the heavy lifting on this project, so I want to acknowledge her publicly for her work in this area. So when we talk about barriers to care, like I mentioned before, I mean, well documented. If you want a great resource, take a look at Puckett and colleagues 2018 publication in this area. Now, what's interesting is the observation that unfortunately, there's the possibility of experiencing microaggressions in the healthcare space that is never appropriate. So we have like misgendering and the misuse of pronouns, misnaming, and so on. But what's also interesting is the observation of what we call educational burdening, the observation that sometimes those seeking care have to educate the providers about the care that they're trying to get. So the burden is placed on the person who needs the help, as opposed to the person who ought to be giving the help in some context. So that was an intriguing observation to make and then to pursue. So this particular project started to look at the possible gaps in training of healthcare providers, particularly mental health care providers. And so in this particular study, the questions or research questions happen to be the type of training that providers get to offer or to be able to deliver TGD sensitive care, and then also their own sense of competence and comfort in providing care. Now, this particular project was interesting in that we had a targeted group of respondents in this particular study. So we identified, or we were able to get the names of gender therapists. These are individuals who, based on their professional websites, advertise themselves as being gender therapists, and therefore interested in and comfortable working with individuals who may identify as TGD. These participants had taken part in an earlier study, Holt et al., and I will link the reference slide at some point in this talk. And so we simply asked them would they consider completing this survey specific to their training, the type of training that they received, how they got to be competent or comfortable providing care. They received a small incentive for taking part. And in this particular project, we had about 142 respondents who completed the entire survey, and therefore I'm going to reference them in particular in this talk. So what was comforting to observe was the fact that these individuals did indicate that, yes, they had TGD specific training. They were more than comfortable working with TGD clients, caring for these clients and so on. They spent more than 25 hours in training to be able to do this. And they received training from, on average, most frequently, one to three sources and so on. So we asked them to tell us, again, in their own words, what training did you get? How did you get your training? Who trained you basically to do this work and to do it, to be competent in it? And so that's where it got really interesting, because they gave a whole host of spaces that they were able to acquire information from. So graduate programs, and then professional organizations, at university, hospitals, like on the job training, as it were. And as a matter of fact, about 3 or 4 participants did share with us that they got training from their clients. So there's that educational burdening still happening, and these are individuals who identify as gender therapists. So they're the ones who say, yes, we want to work with in this space, and we want to do this type of work. But yet you see the plethora of places that they have to get training from. So what this suggests to us is that when we talk about health inequities, and we talk about eliminating or ameliorating inequity when it comes to healthcare and so on, we really need to take a look at how we're training providers of healthcare, and how we're introducing some of these topics, and how they're getting experience, practical experience working with clients. So my work with Trans Collaborations continues. I have 2 other projects with them right now. One of them focusing on the idea of resilience, building resilience with TGD young adults, and the role of family in that particular space. And then also we have another project that looks at again, healthcare provider training, and with respect to cultural competency, and knowing what gender affirming care means, and understanding the terms and so on. So those are 2 projects that I am directly related to, working on with Trans Collaborations. Like I mentioned before, they're doing a whole host of really innovative, interesting things. So I encourage you to take a look at their website, and to see all the work that they're doing, and perhaps have other members come in and chat about what's happening in that particular space when it comes to health inequity and gender identity and so on. What I'd like to do now to wrap things up is to talk a little bit about some resources that one may utilize when it comes to teaching, and when it comes to doing research with respect to gender identity, names, and so on. So I will say this, full disclosure, I work in a very, very small niche area of identity and names and gender and so on. There are individuals who are doing work in other areas in this field in much more expansive ways. But one way to look at identity, there are different aspects you can look at, as illustrated here by Gabe, who is having an identity crisis with respect to the persistence of identity over time and so on. I use this because comics, great resource. I teach in family science. We have to discuss sometimes topics that aren't always comfortable sometimes to discuss. And I find that comics are a great resource to use when you're introducing conversations. It's great conversation starters. And then you can go from there to much more complex, much more expansive discussions. So for example, we have in this, the well-meaning aunt who thinks that the hardest thing about childbirth is picking a name for your child, as the mom is literally sweating from having delivered a baby. So a great conversation starter about what it's like to, prenatal development and so on, and child development and so on. Another great example is one of my personal favorites. A friend of mine sent this to me about a year or so ago now. The idea, we discuss intimate relationships in family science a lot. What are possible outcomes of those relationships? That guy from the barsmith. I mean, come on. And then you have, for example, going back to professional identity, full circle moment here, the idea of caretakers and name changing, and the little one says, what suits is that for? And the mom says, Wanda McPherson, that's my name. And he goes, still, I thought you changed it. And she's like, no, mom, it's just my work name. So for all the moms out there, all the parents, all the caretakers, yes, but all the moms, you understand what this is like. in terms of other resources, if you're all interested in examining names, not just personal names, brand names, trademarks, place names, and so on, consider the American Naming Society. It is a global organization, and you get to have conversations with like professional baby name specialists. You know, that's their job. They get hired to pick names for kids. It's like, wow. So it's a great place to meet, make connections, meet interesting individuals who are dabbling in the space of onomastics or naming in some way. If you're all interested in naming in the US and want to find out like what was the most popular name in, you know, in Nebraska in 1922, consider the Social Security database. They have a names database. It is free to access. You can get names from 1898 until now, separated by state and by year and by region and by decades. So if you like that sort of information, also it's also a great data set to use when you're teaching intro to research methods, because, you know, it's right there, it's free and it's interesting. Trans collaborations doing great work in terms of health equity and in very different ways. So check out what they're doing. If you're all interested in how many of you may exist in the US, it's just an estimate. Check out how many of me, a great conversation starter in classes as well. You talk about, you know, who you are as an individual and your groups and your subcultures and so on. And then professionally, practically, if you have a name that individuals may find difficult to pronounce sometimes, or you want to make sure that people are saying your name correctly, consider creating an audio email signature with name drop. It's also a great tool to use with students, just another way to add to your professional development and so on. So on behalf of my colleagues, my collaborators, my family, both with names and my ancestors who are unnamed, I thank you for your time and your attention today. With profound gratitude. Thank you so very much.